Most people check their blood pressure in the morning. They wake up, they take the reading, they write it down, they feel reassured, or they don't. And then they go about their day. But here is what almost nobody is talking about, and what I consider one of the most important gaps in how we manage cardiovascular health in people over 60. What is your blood pressure doing while you sleep? Because for a significant number of seniors, people who have perfectly acceptable morning readings, people whose doctor is satisfied with their numbers, people who are doing everything right, the answer is deeply concerning. While they sleep, their blood pressure does not drop the way it should. It stays elevated, or it actually surges, and their heart spends 6, 7, 8 hours working under pressure that nobody is measuring, pressure that nobody is treating, pressure that is quietly damaging their arteries, their kidneys, their brain, night after night after night. I have reviewed the histories of patients who came to me after a stroke or a cardiac event, people whose daytime blood pressure was perfectly controlled. And when we looked more carefully at what was happening overnight, the damage had been building for years, in the dark, while they slept. Today I'm going to tell you about the single most effective drink you can have before bed to protect your cardiovascular system during those vulnerable overnight hours. A drink backed by published research, accessible to almost everyone, and something you can start tonight. My name is Dr. Alan Grant. I'm a physician with over 2 decades of experience in cardiovascular health and senior longevity. And today I'm going to show you the best drink seniors can have before bed to lower blood pressure overnight, and exactly why it works. Stay with me. What you're about to learn could be the most important addition to your evening routine, and it costs almost nothing. Before I tell you what to drink, I need you to understand what is happening inside your body between midnight and 6 in the morning, because this changes everything. In a healthy cardiovascular system, nighttime is a restoration period. Your blood pressure naturally dips by 10 to 20% during sleep. Your heart rate slows. Your arteries relax. It is a biological reset your body has been running every night of your life, a form of maintenance that keeps your cardiovascular system functioning properly over decades. But after 60, that system becomes unreliable. Your blood vessels stiffen. The pressure regulation becomes less precise. Hormonal signals that used to protect the heart during sleep, they start to weaken, and the margin for error becomes much smaller. Here is the clinical term for what happens when nighttime pressure fails to drop adequately. Non-dipping hypertension, and when it actually rises during sleep, nocturnal hypertension. Studies show that non-dippers, people whose blood pressure does not fall at night, have significantly higher rates of cardiovascular events, organ damage, and stroke than people with the same daytime readings who do experience that protective nighttime dip. In other words, your nighttime blood pressure pattern may be more important than your daytime reading. And here is the most important thing I can tell you. Several compounds found in specific foods and drinks have been shown to directly support that nighttime drop, to give your cardiovascular system the signal it needs to stand down, relax, and restore. The drink I am about to describe works through 3 of those mechanisms simultaneously. That is why it is the most effective single thing you can consume before bed for your blood pressure. Let's talk about what it is, and exactly why it works. The answer is not exotic. It is not expensive. And it has been used for centuries across 3 continents before modern research confirmed why it works so well. The foundation is hibiscus tea, but not hibiscus tea alone. What I am about to describe is a specific combination, 3 ingredients, 1 cup, that targets nocturnal blood pressure through 3 completely different biological pathways at the same time. Let me walk you through each one. Component number 1, hibiscus tea, base, hibiscus flowers, dried and steeped, produce a deep red tea with a tart, cranberry-like flavor that has been used medicinally in West Africa, Latin America, Egypt, and the Middle East for hundreds of years. Modern cardiovascular research has confirmed what traditional healers knew empirically. Hibiscus flowers contain compounds called anthocyanins and organic acids, specifically hibiscus acids. These compounds inhibit an enzyme called angiotensin-converting enzyme, the same enzyme that a class of prescription medications called ACE inhibitors targets. When this enzyme is blocked, your blood vessels relax. The resistance your heart has to push against decreases. Blood pressure drops. A study published in the Journal of Nutrition found that daily hibiscus tea consumption reduced systolic blood pressure by an average of 7 points in adults with mildly elevated pressure. 7 points. Without a prescription. Without side effects. Without the persistent dry cough that many ACE inhibitor medications cause. and consumed before bed, when your cardiovascular system is transitioning into its nighttime recovery mode, the timing amplifies the effect. 1 cup. Steep for 5 minutes from dried hibiscus flowers or a quality hibiscus tea bag. The color should be a deep, rich red. The deeper the color, the higher the concentration of active compounds. Important caution: if you are already taking an ACE inhibitor medication, speak to your doctor before adding regular hibiscus tea, because combining both can push your pressure too low. That is the only contraindication worth noting for most people. Component number 2, magnesium, a pinch of magnesium glycinate powder or magnesium-rich honey. Here is where most people stop. They make the hibiscus tea and move on. But there is a second ingredient that dramatically amplifies the nighttime effect, and it addresses a deficiency that is extraordinarily common in people over 60. Magnesium. Magnesium is involved in over 300 enzymatic reactions in the human body. For the cardiovascular system specifically, it plays 3 critical roles. First, it regulates the electrical signals that keep your heartbeat steady. Magnesium deficiency is directly linked to arrhythmia and irregular heart rhythm. Second, it acts as a natural calcium channel blocker, the same mechanism as an entire class of blood pressure medications. It prevents calcium from entering the smooth muscle cells in your artery walls unnecessarily, which keeps those walls relaxed rather than contracted. Third, and most relevant to the nighttime context, magnesium promotes deep, restorative sleep, and the quality of your sleep directly determines the quality of your overnight blood pressure drop. Studies estimate that up to 70% of adults over 60 do not consume adequate magnesium, and certain medications make this worse. Proton pump inhibitors, taken by roughly 15% of the population for acid reflux, directly deplete magnesium with every dose. The practical addition to your bedtime drink: a small amount of magnesium glycinate powder dissolved into your hibiscus tea. Magnesium glycinate is the most bioavailable form, far better absorbed than the magnesium oxide found in most cheap supplements, and it has a gentle, slightly sweet quality that does not alter the flavor of the tea significantly. Start with 100 to 200 milligrams. Work up to 300 to 400 milligrams over time. Always discuss supplementation with your doctor, particularly if you have kidney disease. Component number 3, a small amount of raw honey or tart cherry juice. The third component is optional, but for many seniors it provides a third mechanism that the first 2 do not address. Option A, raw honey, 1 teaspoon. Raw honey, not processed honey, raw honey, contains polyphenols and nitric oxide precursors that support healthy endothelial function. Your endothelium is the thin inner lining of your blood vessels. When it functions well, it produces nitric oxide naturally, which tells your arteries to relax and dilate. Raw honey also has a gentle prebiotic effect that supports gut microbiome health, and emerging research is increasingly clear that gut bacteria directly influence blood pressure regulation through multiple pathways. 1 teaspoon. No more. The goal is the polyphenols, not the sugar. Option B, 2 tablespoons of tart cherry juice, unsweetened. If you prefer to avoid honey, tart cherry juice is an exceptional alternative. Tart cherries are one of the richest natural sources of melatonin. Melatonin does not just regulate sleep, it has direct cardiovascular effects. It reduces oxidative stress in blood vessel walls. It lowers nighttime blood pressure, and it helps reinstate the normal nocturnal dipping pattern in people who have lost it. A study published in the American Journal of Clinical Nutrition found that tart cherry juice consumption significantly improves sleep quality and duration in older adults, and better sleep means a better overnight blood pressure profile. 2 tablespoons of unsweetened tart cherry concentrate added to your hibiscus tea. The flavor combination is actually very pleasant. Tart, slightly sweet, deeply red. Here is exactly what to prepare and when. Ingredients: 1 hibiscus tea bag or 1 tablespoon of dried hibiscus flowers, 8 ounces of hot water, not boiling, about 90 degrees Celsius, 100 to 200 milligrams of magnesium glycinate powder, 1 teaspoon of raw honey or 2 tablespoons of unsweetened tart cherry concentrate. Method: steep the hibiscus for 5 full minutes. The water should turn a deep, rich red. Remove the tea bag or strain the flowers. While still warm, not hot, stir in the magnesium glycinate until fully dissolved. Add the honey or tart cherry juice. Stir gently. When to drink it: 30 to 45 minutes before you intend to sleep. Not immediately before. You want the magnesium and hibiscus compounds to begin working as your body starts its transition into sleep mode. What to expect? In the first week, Many people notice improved sleep quality before they notice a change in blood pressure readings. By weeks 2 and 3, morning readings often begin to reflect a more significant overnight drop. Give it a full 3 weeks before evaluating. Now that I have told you what to drink, let me spend a moment on what not to drink, because for many seniors, removing one habit is as important as adding another. Alcohol. Even 1 glass of wine before bed raises nighttime blood pressure. It disrupts sleep architecture. It increases the frequency of awakenings. And it prevents the deep slow-wave sleep during which the most significant cardiovascular restoration occurs. If you drink a glass of wine with dinner, finish it by 7 p.m. at the latest. Caffeinated beverages after 2 p.m. Caffeine has a half-life of 5 to 7 hours. A cup of tea at 4 p.m. still has significant caffeine activity at 9 p.m. It raises blood pressure directly and disrupts the melatonin production that initiates the nighttime cardiovascular dip. High sodium foods within 2 hours of sleep. Sodium causes fluid retention. Fluid retention raises blood pressure. And the kidneys, which work to clear sodium, function less efficiently in older adults, meaning the effect persists longer than it would in a younger person. Large meals within 3 hours of sleep. Digestion demands significant blood flow. The heart has to pump harder. Blood pressure rises. And the body's attempt to shift into recovery mode is directly competed with by the demands of digesting a full dinner. I want to tell you about a man I'll call Harold. 73 years old. Retired engineer. Methodical, careful, the kind of person who tracked everything. He came to me with something that had been bothering him for months. His morning blood pressure readings were good. His doctor was satisfied. His medication was working. Everything looked fine on paper. But Harold felt terrible every morning. Exhausted despite 8 hours of sleep. Foggy. Slow to start. A slight headache that usually cleared by 10 a.m. He told me, "I feel worse in the morning than when I went to bed." That sentence is a clinical red flag. And I told him so. We arranged for a 24-hour ambulatory blood pressure monitor, a device he wore for a full day and night that took readings every 20 minutes, including during sleep. What we found was striking. Harold's daytime readings were excellent. 122/76. Perfectly controlled. Between 2 a.m. and 5 a.m., his systolic pressure was consistently running between 158 and 167. His heart was under significant stress during the exact hours when his body was supposed to be recovering. Nobody had ever measured it. Nobody had ever looked. We made 3 changes. We adjusted the timing of one of his medications to the evening. We addressed his sleep. He had mild undiagnosed sleep apnea. And we introduced the bedtime drink I just described to you. 8 weeks later, Harold came back with his monitoring data. His overnight readings were averaging 124 systolic, a reduction of more than 35 points during the highest risk hours of the night. He told me something I think about often. He said, "I've been going to the doctor every 3 months for 6 years. Nobody ever asked me what my blood pressure was doing at 3 in the morning. I didn't know there was a 3 in the morning problem." There was, and it had been there for years. I want to say something directly. The information I shared today, nocturnal hypertension, non-dipping patterns, the 3-component bedtime drink, none of this is cutting-edge experimental medicine. It is published research that exists in peer-reviewed journals and is known to physicians who specialize in this area. But it almost never makes it into a standard 10-minute appointment. There is simply not enough time. And the assumption, often wrong, is that if daytime numbers look fine, everything is fine. Everything is not always fine. You now know to ask the right questions. You now know what your blood pressure might be doing at 3 in the morning. And you now have something specific, simple, and evidence-based that you can do tonight. You are not a passive recipient of whatever reading appears on a blood pressure monitor once a week. You are an active participant in what happens inside your cardiovascular system every single hour of every single night. The drink I described costs less than $2. It takes 5 minutes to prepare, and it works through 3 independent biological mechanisms to support the overnight pressure drop your heart depends on. That is not a small thing. The best drink for seniors to lower blood pressure before bed, and exactly why it works. The foundation, hibiscus tea, acts as a natural ACE inhibitor, relaxing blood vessel walls through the same mechanism as prescription medications. 1 cup, steeped 5 minutes to a deep red color. The amplifier, magnesium glycinate, 100 to 200 milligrams dissolved into the warm tea. relaxes arterial smooth muscle, supports cardiac rhythm, promotes deep restorative sleep. The most bioavailable form of magnesium. The enhancer, 1 teaspoon of raw honey for nitric oxide support and endothelial health, or 2 tablespoons of unsweetened tart cherry concentrate for direct melatonin supplementation and sleep quality improvement. When to drink it? 30 to 45 minutes before sleep. What to avoid? Alcohol, caffeine after 2 p.m., high sodium foods, large late meals. What to expect? Improved sleep quality in week 1. Measurable blood pressure improvements by weeks 2 and 3. If you have not had your overnight blood pressure measured, ask your doctor about a 24-hour ambulatory blood pressure monitor. One night of data could reveal a problem that years of morning readings have completely missed. I want to hear from you. Have you ever had your overnight blood pressure measured? And has a doctor ever asked you specifically what your blood pressure is doing while you sleep? Tell me in the comments. I read every single one. And if you have been experiencing herald symptoms, exhausted despite a full night of sleep, headaches in the morning, foggy until mid-morning, write that too. You may not be alone. And your comment might help someone else recognize what is happening to them. If this video gave you something useful, please share it. Not for me, for someone in your life who checks their blood pressure every morning, gets a reassuring number, and has no idea what is happening while they sleep. Send this to them tonight. It could change everything. Everything shared in this video is based on current published research and peer-reviewed medical literature. This is general information, not personal medical advice. Every person's situation is unique. Please consult your own doctor before making any changes, and never stop or reduce any medication your doctor has prescribed without speaking to them first. If you are taking ACE inhibitor medication, speak to your doctor before adding regular hibiscus tea. Take care of yourself. Your body has been working for you every single day of your life. Give it the attention it deserves.